Penanganan pandemi COVID-19 di Gaza menjadi sorotan dunia. Pasalnya, sebagai daerah konflik, Gaza saat ini masih berada di bawah blokade Israel. Bagaimana hal tersebut memengaruhi kehidupan warga di Gaza, Palestina? Kami akan membahasnya dengan Dr. Natalie Thurtle yang merupakan Koordinator Medis MSF atau dokter lintas batas di Gaza, Palestina.
Okay, hello, Dr. Natalie.
Hi,
Good morning. It is our pleasure for having you today on CNN Indonesia Connected. Dr. Natalie, with the active number of COVID-19 in Gaza still increasing, how do you measure the government efforts to push back the pandemic?
I think the authorities have done their best with the support of the international agencies that are working there, including MSF. It's a challenging disease to contain in an environment with very high population density and poor healthcare infrastructure. So for sure, there's a lot of challenges.
Dr. Natalie, how do you portray the conflict escalation in Gaza territory during this pandemic?
So Human Rights Watch recently released a report that violence overall has decreased over the course of 2020. However, recently during Ramadan, there were some clashes, which is often the case, and OCHA have released data this morning highlighting that 120 Palestinians have been injured recently over the last 2 weeks. Which is significantly more than the number of Israelis who've been injured, which is 24. So certainly there's a ongoing impact from the violence, and the Gaza people in particular remain in a precarious position because of the long-standing blockade.
Okay. Oh, no. And as we consider now, Gaza is still in Israel blockade, right? How does it affect the medical facilities and logistic distribution in Gaza, including the vaccine?
So there's a lot of permits and importation processes to go through to get medicines into Gaza. And even before COVID, Gaza was running with about 30% less of the essential medications than they should have. So for sure it has a big impact on bringing in supplies required for COVID. Also, the long-standing impact of the occupation has made it difficult for there to be proper supply infrastructure and a responsive setup for emergency ordering. Regarding vaccines, the supply of vaccines to Palestine has not been sufficient. It's difficult to say whether that's related to the blockade. I think it's multifactorial with difficulties in supply for low and middle income countries all over the world.
Doctor, many countries down to the economic recession amid the pandemic. Can you explain a little about the economic recovery in Gaza?
So Gaza has already had a lot of insults to its economy with regard to the situation with Israel and the impact of the blockade. And as we entered into the pandemic, we had 50% of the population living below the poverty line and 50% unemployment. So you can imagine the impact of the pandemic on that sort of status. And for sure, there's a lot of people in Gaza who live day by day and hand to mouth, and therefore it makes it really difficult for the authorities to put in place robust public health measures like extended lockdowns when there's a big surge, because people simply can't survive without their day-to-day income.
Okay, there's a struggle for real. Dr. Natalie, regarding the COVID-19 response, what might be slow down the efforts there in Gaza, as you can analyze?
Sorry, just repeat?
What might be slow down the effort to push back the pandemic of COVID-19 there in Gaza?
What's slowing it down?
Yeah.
Look, I think that the surge that they've just been through, the second wave, which was predominantly B117 variants, which we know to be more transmissible and cause more severe disease, was very intense, and I think the number of cases would have overwhelmed many infrastructures. So the sheer volume of cases that they're receiving has been really difficult for this quite fragile structure to manage. They have difficulties with supply of consumables, and primarily the biggest concern at the moment going forward is the lack of access to vaccines. So they've only managed to vaccinate about 5% of the population overall in Palestine. And there's lots of small streams of vaccine supply coming through, but it's not looking realistic for a large-scale rollout in the near future. So we're thinking now about the rest of 2021 heading into more waves, and each time the community is less resilient because they've been through a lot already, and so are the healthcare workers that are trying to make sure that people recover.
Okay, the healthcare overwhelmed by the situation. Dr. Natalie Thurtle, thank you very much for your time with CNN Indonesia Connected today. We really appreciate your time, and we wish you always mark yourself safe in Gaza, Palestine. Thank you, Dr. Natalie.
Thanks for your time. Thank you.